Hello, my name's Christine Gates, and welcome to Medicare 101 The Basics. This is a shortened version of our usual Medicare 101 that we do in the Senior Center live. If you come into the Senior Center the first Friday of each month at noon, we do a detailed New to Medicare seminar that lasts about an hour and includes question and answers, and will stay even longer if you've got some points that are unclear. I'm the director over at the Senior Center, and if you're listening to this, it's probably because you're turning 65 and you've been inundated with mail about all your choices for Medicare, and we're hopefully going to help you understand that. So we're going to talk about who's eligible, the 4 parts of Medicare, Medicare A, B, C, and D, and programs for people with limited income and resources. So what is Medicare? Medicare is a federally sponsored individual health plan providing coverage for medically necessary procedures and services. Medicare coverage requires co-pays, co-insurance, and deductible payments that are the responsibility of the beneficiary or the secondary insurance. So we're going to talk about what that means. Who's eligible? You're eligible for Medicare if you're over 65 and participated in Social Security, railroad system, or federal, state, or local employees, or you have a spouse who participated. I'm sure that's clear as mud already. Individuals under age 65 have been awarded Social Security or railroad disability after 24 months. They're also eligible for Medicare. Those who are disabled due to Lou Gehrig's disease or end-stage renal disease, for just 2 examples of disabilities. But we're going to talk about all of this. Okay, the 4 parts of Medicare. There's Medicare A, B, C, and D. Medicare A is the hospital part of Medicare, and it covers expenses in the hospital. Now, Medicare covers 80%. You pay the other 20%, plus co-insurance, co-pays, and deductibles. Medicare Part B is the medical or the doctor's office part of Medicare, and you, again, would be responsible for 20%. Medicare pays 80%. Part C is a Medicare Advantage plan, and they're called a complete plan or an all-in-one, or they have various names depending on the insurer. So if you have Medicare Part C, you don't have original Medicare. You are in an insurance company group. So you may be in the United Healthcare or a Humana or an Aetna group, and it could be an HMO or it could be a PPO. And they will have different co-pays and co-insurances that you would pay. They have different premiums, and you're in that insurance network, not in original Medicare, even though it is still technically considered original Medicare or Medicare, but it's not original Medicare, which is Medicare A and B. Then there's Medicare Part D, which is the prescription drug plan, and everybody should have that. If you don't get it when you should, then you could have a penalty, and I'll explain that later. But the drug plan is, again, with another private insurer, so it's with Aetna or Humana, and it would cover prescription drugs like Tier 1, Tier 2, preferred generics, preferred brand names, and they cover differently. So the prescription drug plan differs from person to person depending on their medication and where they buy their medications. So a husband and wife will not necessarily have the same prescription drug plan. We'll cover more of that. What does original Medicare cover? Medicare Part A covers inpatient hospital, skilled nursing after 3 days of prior hospitalization as an inpatient. It covers home health care, hospice, and blood products. That's A. Medicare Part B covers services with physicians, outpatient surgery and services, home health care, durable medical equipment, and blood products. What it does not cover is Medicare. Outpatient prescription medications is not covered by original Medicare Part A. Routine dental care is not covered. Vision is not covered. Hearing aids are not covered. Foreign travel is not covered. Cosmetic procedures and long-term care, those are not covered under original Medicare. And then what does original Medicare cost? Original Medicare is generally free. You've already paid into it through your entire working career, and it doesn't cost anything. But some people will qualify for, if they haven't worked their 40 quarters, which is an equivalent of 10 years, they will pay a premium. The premium varies from person to person, and we can discuss that in person if you fall into that category of not working 10 years. So what does original Medicare cost? Since you're not paying additional premiums for Part A, Part B, the standard Part B, the doctor part of Medicare for 2018 is $134 a month. However, if you're a single and your income is more than $85,000 or married and more than $170,000, you'll pay a little bit more on your premium. And again, I've got charts and I can show you that. Note, the Part B premium is typically automatically deducted from a person's Social Security retirement benefits. You don't get the option of paying them directly. They deduct it right out of your Social Security. Automatic enrollment. If you are collecting Social Security prior to age 65, they will automatically deduct it. They will automatically enroll you in Medicare. So if you're 62 and you start drawing your Social Security benefit, when you turn 65, about 3 months before, maybe 4, Medicare will send you your Medicare cards. You don't have to do anything. If you're not already collecting Social Security, then you'll have to call Social Security and tell them that you want to sign up for Medicare. And it's you can do it over the phone. They mail you the cards, and if you want Part A and Part B, because maybe you're going to quit working and you're going to take that as your new coverage, then you would keep the card. If you're going to keep working and you're only going to take the hospital part of Medicare, Part A, you can cross off the B and write declined on there and send the card and the letter back, and they'll send you just coverage for Part A, and your employer can continue to cover the doctor part. There's so many ifs and variables. Your initial enrollment period, when you're turning 65 and not collecting Social Security already, is the month that you turn 65. So Medicare is effective the first of the month when you turn 65. So if your birthday is July 15th, your effective date is July 1st. And you can enroll 3 months before. So you can enroll in June, May, and April. You also, without any penalty, you can enroll 3 months after. So you can enroll, if your birthday's in July, you can wait till August, September, or October to enroll and still have coverage with no penalty. And we can help you with that. So if you stop by the office, we can help you. The general enrollment period is for those who do not enroll during their initial enrollment period. And that begins January 1st through March 31st. So if you're 67 and you still haven't signed up for Medicare, you just stopped working and you're not collecting Social Security, if you waited around 2 years, you can enroll in this general enrollment period. So don't panic that you're not ever going to get it, but your coverage won't start till July 1st. You'll have to wait. There's special enrollment periods. If you work until 67 and you didn't take Medicare and you're now going to actually retire, There's a special enrollment period for you for your retirement date. So if you're going to retire in October, come and see us in September or October, and we can start the paperwork for picking your Medicare plan and your Part D, your drug plan, and give you some information about the supplement. And then you get a special enrollment period for the loss of your employer insurance in October. So don't panic. How do you enroll? I talked about that. You would just call Medicare or Social Security, and you can do that over the phone. It will happen, I'll say it again, it will happen automatically if you're already drawing Social Security benefits at age 62. If you started at 62 or 63, 64, if you're already drawing Social Security, Medicare automatically happens. Okay, now Medigap Policies. This is where people have lots of questions, and this is the mail in your mailbox. Medicare Supplement. They're standardized plans, and it's plans A through N. So Medicare is parts, Part A, B, C, D, parts. The supplement is a Plan A, a Plan B, a Plan C. We recommend a Plan F or a Plan G. Plan F covers everything that Medicare doesn't cover. So when I said in the beginning that Medicare Part A and B cover 80% and you cover 20%, the supplement, the Medicare supplement or the Medigap plans, it covers that 20% Medicare doesn't cover, and then depending on the plan that you pick, it will also pay all the copays, the co-insurances, and the deductibles for you. Plan F is the one that we generally recommend, and it covers everything. So you have no out-of-pocket. There's no copays to pay at the office. There's no deductibles to pay if you go in the hospital because it pays it. Plan G is a little bit cheaper. It's about $30 to $40 a month cheaper, and it will pay everything that Medicare doesn't pay except one thing. You pay the Medicare Part B annual deductible. So that's $184 or $83. You would pay that once a year, and then you would save that $30 or $40 a month. So you come out ahead if you'll pay that. It's cheaper, and there's nothing wrong with that plan. There's also, I should say, since they're all standardized, we can give you a list of all the insurers in North Carolina that offer the Medicare supplement plans, and you can see all their rates. Then you can pick one. We'll give you all the contact information. You can call them and pick it over the phone, and you can do it by the rate, and then not have to pay too much for it. Or you can go to your local insurer and you can ask, which of these plans do you offer, and you can buy it direct local right here from your typical insurance agent. We can't sell those or enroll you in a supplement plan, but we can enroll you in a drug plan. If you have Aetna and Blue Cross Blue Shield, if you see those two plans, the rates will probably be different, but a Plan F is a Plan F is a Plan F. It doesn't matter what the company's name is, they still cover identically. So an F plan is going to cover everything Medicare doesn't cover, and you have no out-of-pocket expenses. If you have a Plan G, all those carriers, and there's about 30 of them, they all cover exactly the same. The only difference is the rate. Your monthly premium or annual premium is going to be different. And we can talk about that. I can explain it. We can give you a printout for you, and you can take it and look at it. There's also other secondary insurance options. Some people will have Medicaid if they meet the income requirements. Tricare for life is for military retirees and their dependents. Federal and state plans for retirees. And then there's employer group plans. So if you fall into one of those categories, You may have a secondary coverage or a supplement that picks up everything Medicare doesn't cover in your retirement plan. If that's the case, then we don't do any counseling for you guys. You guys go straight back to your employer, the state, the local municipality, and you talk to their benefits coordinators to see what's offered with Medicare. If you have an employer plan for Medicare, some of them offer a Medicare Advantage plan instead of a supplement. So if you've got questions, we can try and answer questions for it, but generally we just refer you back to the employer to discuss all that and get the details. Okay, so now we're going to just go right into Medicare Part C, and those are the Medicare Advantage plans. So if you want to pick one of those, I think there's 7 options this year for you, and some of them are PPOs, preferred providers, or they're HMOs, the health maintenance organizations. And what varies about them, besides the premiums, is the coverage area. So some of them cover, one of them covers Virginia, North Carolina, and South Carolina. That's the whole region of coverage. But we still ask that you call all of your specialists, your primary care physician, and the hospitals that you would probably use, and ask, are you in this network? Talk to somebody in the billing department for your family care and ask, which of these Medicare Advantage plans do you take? So if you're considering it, you've got a lot of homework. We'll give you a big packet of homework to do before you make that decision, because the tricky part is those people in those networks, the physicians and hospitals, they can leave the network at any time. You cannot. You are in it for a year, and it's too bad if your physician leaves or the hospital that you want to go to leaves, because you still have to, you're going to either have to switch or you're going to have to pay a lot of money out of pocket. And they can get kind of unpredictable, but they will cost you less generally, because you're going to pay your Medicare Part B premium, and then you're going to pay whatever the Part C premium is. And sometimes it's $0. Sometimes it's $30 or $80 or $150. But then that's it. But then you have lots of copays. You have copays and coinsurances that you're paying along the way. And we have a really hard time comparing one plan to another. The only definite we can do with a Medicare Part C plan, the Medicare Advantage, is to tell you how much you'll pay out of pocket for your medications. That's really all we can do. That's why we give you the packet and let you try and call your physicians and see who's in network. If you're going to enroll in a Medicare Advantage plan, it's the same as the drug plans. You can move around once a year during open enrollment, and that's from October 15th to December 7th. And we can enroll you, but we only do it after you've done all that homework. You call all the physicians, and you have a really good idea of what it's going to cost you. But that's open enrollment, and that's every single year you can switch either your Medicare Advantage plan or your drug plan, and you would want to come and see us. Also, anytime throughout the year you may qualify for extra help, and we can do that paperwork for you. If you're gonna choose, if you're considering that Medicare Advantage plan, the Part C, there's a slide up that'll show you that original Medicare covers Part A and B benefits. Medicare provides coverage to you directly, and you have your choice of doctors and hospitals that are enrolled in Medicare to choose from, and that's a wide array of doctors and hospitals. Most doctors take Medicare. Generally, you and your supplement coverage pay the deductibles and the coinsurance, and there's a monthly premium for Medicare Part B, that doctor part that you pay the $134 a month. Everybody pays it. Even if you take the Medicare Advantage Part C, you still pay that Medicare Part B premium. Okay, so that's what's covered. That's how it's covered in original Medicare. Medicare Advantage plans, Part C, that covers Medicare Part A and B benefits, just like if you had original Medicare. The insurance in a Medicare Advantage plan is provided by a private insurance company, and Medicare kind of oversees it. In most plans, you need to use the doctors, hospitals, and providers, and you'll pay co-insurances along the way, co-pays, deductibles, and that's generally what the supplement pays. This is where it gets confusing. Part C, all the mail that you have, they call it a Medicare supplement all-in-one plan, because it sort of covers all of it, but it doesn't cover all of it like a supplement covers everything with original Medicare. Also, in the Medicare Advantage plans, you'll pay a monthly premium unless you meet some kind of an income requirement, or if it's a zero premium plan, but you kind of get what you pay for. Medicare Part D. Okay, now we're going to go to the drug plan, which is the kind of work that we do every day at the senior center with our counseling. You need to pick a Medicare prescription drug plan. Everybody does, and if you don't get one, there's a penalty. It's 35 cents a month for every month you could have had it but didn't. So after 10 years, you're paying about $50 more a month than you would have if you just had it in the beginning. And the penalty isn't for 1 month, the penalty is forever. So if you can get it, you should get it, even if you're not taking any medicine, because there's some of them that are $15 a month, and it's worth not having that penalty to just pay the cheapest plan and go on, even if you're not taking medicine. Again, though, the Medicare Part D plans are administered by private insurance companies, kind of similar to the Medicare Advantage plans. Medicare Advantage, or the Part D plans, you want to have them looked at every year. You want to come by and see us in September, fill out one of the sheets, let us reanalyze your drug plan to make sure you're in the best plan this year to next year. I just looked at somebody's yesterday and saved them $99,379. Just making sure that they're in the right plan and applying for extra help. So every year during open enrollment, this person had a special enrollment period, but every year during open enrollment, everybody needs to have their drug plan looked at, because it's not uncommon that we save you $1,000 for the year. I think our average last year was $1,800 we saved everybody. We had 250 people come in and saved them an average of $1,800, and who wouldn't want to save that? Some people save $20,000 or $30,000 if they're taking something expensive, and then we match them up with the proper insurance company that covers that expensive drug at a lower cost than anybody else. So it's a big benefit. Open enrollment's really important for Part D plans. And then if you can't afford your drugs and you meet the financial requirements, and we'll help you with that, we can do an extra help application through Social Security, which means that Social Security pays about $35 of your monthly Part D drug premium, and then it reduces the cost out of pocket for the medications that you buy. And that is a huge help for people who are low income. So if you think that you meet the requirements, it's around $1,500 a month. If your income is under that, come and see us and let us fill out an application for extra help for you, and we'll see if we can save you a lot of money. And then to enroll in that plan, it's similar. You do that when you're 65 or when you go on a Medicare. If you work later, you have that same 7 months like you do for Medicare A and B. You have 3 months before your birthday, the month of your birthday, and 3 months after to enroll with no penalty. And we can help you with all of that. We can give you all the choices. You can look at all the choices and decide which ones you want to go to. There's also, let me back up a little bit, Medicare Advantage. If you pick a Medicare Advantage plan, some people have been so surprised by the coverage in January that the government has given you a special disenrollment period. So if you get into a Medicare Advantage plan, the government gives you an out. If you get out by February 14th, they'll let you go back to original Medicare. Because people were very surprised when they got in there and it wasn't what they expected. So if you're having a big problem, please come and see us and let us try and help you. Let's see, differences between Medigap plans and Medicare Advantage plans. Okay, Medigap is the supplement. That's what we call a supplement all the time. They're also called Medigap because it's the gap between what Medicare pays and what pays the entire bill. So that gap is the supplement. In both cases, a Medicare Advantage and a supplement plan are provided by private companies. The government just does oversight. So with the supplement plans, the state administers the plans, and they have to follow federal laws for coverage. So like I said, they're standardized, and a Plan F is a Plan F is a Plan F. Also, with Medicare, the Medicare supplement plans, it works only with original Medicare. So if you have a supplement and Medicare Advantage, you're just paying for coverage that you can't use. So your supplement goes with original Medicare. That's Part A and B. If you have Medicare Advantage, that's Part C. There is no supplement that goes along with it. It's rolled into it. The coverage for the supplement pays the gap in original Medicare, like the deductibles, the coinsurance, the copays for Medicare services. In the Medicare Advantage plans, the Part A and B covered services and supplies are paid for, but it does not cover things like vision and dental. Most plans include Medicare prescription drug coverage, but not all of them. So you want to make sure that there's a drug plan with your Medicare Advantage plan. In both cases, with the supplement and with the Medicare Advantage, you must have Medicare Part A and B. If you have the supplement, you have A and B, you're paying for B. A is already paid for through your working life. Medicare Advantage, you're paying for B, but you're in that private insurance network. You're not in original Medicare. And then at the bottom here it says, do you pay a premium? Yes, you pay a premium for both of them. Both of them you pay Medicare Part B. If you're going to pick up a supplement, you're going to pay for that, and that's generally $80 to about $120 a month. And Medicare Advantage, it varies from plan to plan. Your Medicare coverage choices, this is a good chart right here. You either have original Medicare or you have a Medicare Advantage plan. You don't have both of them. So under Original Medicare, you have Medicare Part A and Part B. That's hospital and doctor. And then you add, if you choose to, the Medicare supplement for an additional premium. You can add a Part D. You should add a Part D. If you don't have a Part D, there's a penalty 5 to 10 years down the road when you decide you want to pick it up. But you don't have to have it, just like you don't have to have a supplement. But if you generally have, when you turn 65, if you get Original Medicare Part A and B with a supplement and a Part D drug plan, you're paying about $250 a month. That's what it'll cost you. If you decide to go to Medicare Advantage, that Part C plan combines A and B and may or may not include a Part D. Now, is everybody confused with the alphabet soup? It's very fun. So if you have Medicare Advantage, that's a lot of the mail that you have. You have Medicare Advantage mail and you have supplement mail because they want to sell you those, but they don't work together. So if you have on the right side, Medicare Advantage, you have Part C, and then the drug plan is either in it or not. If you don't have a drug plan with your Medicare Advantage, you can't pick it up separately. So you just don't have it. So be careful when you pick that. And then on this very last slide, where can you go get help? Our training is all through the Seniors Health Insurance Program through SHIP. The North Carolina Department of Insurance. They provide training, they provide statistics for us, and their phone number is 855-408-1212. You can call them anytime and get help, impartial, unbiased help, just like you would get from us. So you can come see us or you can call them on the phone. You can call Social Security, they'll help you enroll, and you can call Medicare. If you don't come to the senior center and you want to do it all from home, you can call Medicare and give them all the information you would give us. Give them your medications, the pharmacy that you shop at, and they can tell you which is the cheapest plan for you out of pocket. So there's two different places you can go on the phone for help with your drug plans. Social Security, you're just going to call if you need help enrolling in Medicare. And anyway, we hope that you'll come by and see us at the Senior Center. Please come by every year during open enrollment in September and October. Fill out one of the sheets. Let us help you pick your drug plan, and maybe we can save you a couple $1,000 or $10,000. And that is it for today. If you've got questions, call us at the Senior Center, 632-1717. Thank you.